Dr. Nima here to discuss why I became a facial plastic surgeon. I want to take you a little bit on my journey of how I ended up here, and it might be a little piece of advice or perspective for, younger people trying to decide what they want to do, and maybe give some reassurance that you don't need to know exactly what you want to do while you're still young. And I firmly believe that your 20s are a good time for you to explore lots of different options and really use that time to become very self-aware of what you like and what you don't like. And it's okay not to like certain things that other people like, so those things are very, very important. You really want to take into account lifestyle, how much you want to work. So in my journey, I knew I wanted to be a doctor because I really enjoyed biology. I enjoyed medicine and helping people. And I really wanted to have my own practice because I come from a family of business owners and I wanted to run things the way that I wanted them to be run and not under some big corporation or academic institution. So I kind of knew a couple things in advance of what I wanted. When I got to medical school, deciding what kind of doctor you want to be is also a daunting task. There are probably 50 to 100 different types of doctors that you can be. So I knew I wanted to be a surgeon. I loved working with my hands. I find it very fascinating to be able to correct someone in a single day or a single operation that can effect a change for the rest of their life. So I knew I wanted to be a surgeon that essentially eliminated a lot of other specialties, including like internal medicine and radiology, among others. Next, I thought about my lifestyle. I knew I wanted to have a nice lifestyle where I wouldn't be called into the hospital for any kind of emergency. So that pretty much eliminated most like trauma surgery or general surgery, meaning like people who have appendicitis or an acute abdomen is what it's called. So they get called in the middle of the night for something going on in their belly and you have to go to the hospital. Next was like what part of the anatomy? Like I knew I didn't want to deal with genitalia. So that essentially eliminated OBGYN, urology, and eyeballs were just not that fascinating to me. And really the few options left over, one of them was head and neck surgery or ear, nose, and throat. And in head and neck surgery, we focus on quality of life issues. These are people who can't breathe, can't smell very well, can't talk. And within ENT, facial plastic surgery is a subspecialty. So in facial plastic surgery, I get to do a lot of surgery. I get to help people live the best life possible. I get to help them breathe better, make them feel better about themselves, and run my own practice. And I can practice some of my artistic craft. So again, having some kind of like deal breakers in your mind as you're moving through your journey of figuring out what you want to do for the rest of your life and being okay with certain things, like having a decent lifestyle so you can spend time with your family. So that's my journey of how I became a facial plastic surgeon. And if you want to know more, please let me know.